Hi. So we'll start this week off. We're going to be looking at economic epidemiology, chapter 21 of the textbook. So epidemiology is the study of how diseases spread between individuals and clusters of social networked people. And so what does this have to do with economics? Well, in economics, what we study is how people's behavior changes when a new virus is introduced. And it's actually really critical to understanding the costs of an epidemic and designing appropriate policies to limit disease spread. So people are willing to do undesirable things in order to avoid an illness, especially like a costly illness like coronavirus. So we're kind of living in the midst of that right now. Universities are going fully online. Businesses are shutting down. There is a very high demand for self-protection right now. So the textbook kind of like illustrates this concept like a disease. So it's like a tax. So a disease is a kind of tax that you only have to pay if you get sick. So people who take kinds of measures to avoid paying taxes, the cost of those measures is similar to the cost that people are paying to avoid paying the tax of illness. We'll come back to that in a little bit. But what kinds of costs of illness are people trying to avoid? There's two kinds of costs that we're going to talk about. The first one is the excess burden. So this is beyond just the direct costs of the disease, but these are all of the costs associated with the activities that people undertake to avoid the disease. So if we're thinking about it in the context of coronavirus, a lot of this applies. The cost of missed work and missed school days, the costs of personal protection equipment, like face masks and condoms, and also vaccines, the costs of getting the vaccine which prevents the illness. And lost tourism in malaria-infested regions is the example in the textbook, but really everywhere right now. Hotels are pretty much closed, and no one's flying. The epidemiological costs are the more direct costs of a disease. So pain and suffering is a cost that a person has to pay when they get an illness, the cost of directly providing medical care, and the cost of reduced life expectancy. A lot of times we think about the epidemiological costs, but we might forget to consider the excess burden when we're considering the cost of an epidemic. And I don't think we will do that with the coronavirus. But when we're thinking about just historical events of different kinds of disease outbreaks, excess burden, the costs associated with all of those activities that people undertake to avoid getting the disease, can be pretty massive. Just like the epidemiological costs, those direct costs of the disease and its treatment. So the total economic cost is going to be the combination of those two, the sum of the two. For an example, polio in the United States, there are 0 polio cases in the US. So the epidemiological costs are $0 because there is no treatment going into people who are, or like pain and suffering of people who have polio, because people don't have polio in the United States. But still, every year, millions of infants receive that polio vaccine. So the excess burden, which is the cost of those activities that we undertake to avoid getting the disease, is actually pretty considerable for polio. So even though it's been eradicated, it still imposes significant economic costs each year. The cost of making the vaccine, the cost, like the time of administering it, which would be its excess burden. Both the excess burden and the epidemiological costs are going to depend on how severe the disease is. So something like the common cold, and we're going to mark severity with theta. So if something that has, just like the common cold, that has a pretty low severity versus, let's say, Ebola, which is a really severe illness. If you get it, you die. Usually, it is usually fatal, and it has a lot of suffering. So the severity is really high. Now, even if one, like the common cold is pretty common, but not very severe, versus something like Ebola, which is much more infrequent, like it doesn't really happen that much, even though when it does, it's really severe. They can have the same epidemiological costs, even though one is much more common but much less severe. So for the common cold, the excess burden is pretty small. We don't really do a lot to protect ourselves from the common cold. Versus with Ebola, there was really extensive public health infrastructure in place in the United States to avoid the transmittance of Ebola from countries where there were outbreaks. So most of the economic cost might go in the excess burden, like really trying to avoid, you know, transmittance of the disease because it's more severe. So back to this idea of a disease like a tax. So like an income tax, the more you work, that means that the more tax that you have to pay. Similarly, or like analogously, the more exposure you have to a particular disease, the higher expected cost of that disease. As the tax increases, meaning the severity of the illness, so too increases the excess burden of prevention, both when we're talking about income taxes and when we're talking about disease tax. So basically, when income taxes are really high, people are going to try to find ways to avoid having to pay that tax. Similarly, when the disease is really severe, people are going to take costly measures to avoid having that. When a case of Ebola is discovered, towns go into really quick, rapid response to quarantine and to fly in uncontaminated foods from other parts of the world. You're going to do a lot to try to avoid transmittance of the disease. Self-protection depends on prevalence. So the demand for self-protection is related to both severity and prevalence. And when we're thinking about prevalence, so prevalence means the proportion of a population that has a given disease. And there is like an elasticity for self-protection with respect to prevalence. That elasticity, basically what that means is like how the demand for self-protection might vary with the prevalence of a disease. So for example, as rates of HIV increase, condom use increases too. So, and at the same time, as the coronavirus came around, rates of face mask protection also came around pretty quickly. And so the rate of increase in face masks versus the rate of increase in condom use would be the two measures of like elasticity of the demand of self-protection with respect to the prevalence of the illness. How quickly are people, and how widespread is the practice of people, going out for personal protective equipment as the prevalence of the disease increases. And the thing is that when the prevalence of the disease decreases, people are pretty quick to stop demanding personal protective equipment, to the point where it actually makes it really difficult to totally eradicate a disease, because by the time the prevalence rates gets very low, people stop demanding self-protection. So this is a graphical example of what that means. So we can start at the bottom. When there is more disease and then move along with the arrow, there's going to be more demand for self-protection, which in turn is going to help stop the transmittance of disease. So we're going to have less disease. But when there's less disease and it feels like less of a threat, then that's going to lead to less demand for self-protection, which itself can actually end up causing more of this disease transmission. So in the next video, we're going to talk more about disease control.